Respected chairperson of this session, with the blessings from our master, Dr. Christian Frederick Samuel Hanneman, who gave us a beautiful science, which gave us name, fame, money, everything. Thank you, sir. Today, the topic which I am going to discuss is something different because we have been hearing yesterday so much of topics with homeopathic therapeutics, repertory selection, and rubrics. Today it is different because it's related with the research topic which I did in my PhD course. Years and years, we have been facing a major issue. Even though our system of medicine is well proven and solid science, it has been severely criticized and ridiculed by the medical doctors or community or scientific community, as there is no credible proof to prove that our system of medicine works beyond placebo. The medical community and scientific community, they need rigorous and reliable scientific evidence to trust any system of medicine, including our system of medicine. So, some possible ways which we can go with that one is, everywhere we know that now the world is going to evidence-based research. In that one, we are having one pyramid where systemic review and meta-analysis is on the top plane, followed by randomized control trials, which is the gold standard in clinical medicine. We can perform systemic reviews and meta-analysis of existing RCTs. This is which the young generation has to take up because there are several researches which has done. It has to be reviewed, analyzed properly, and you just see that if there is any heterogeneity or any biases there. Followed by randomized control trial, which is the best proof in clinical medicine, which has to be done through high quality placebo controlled trials, which with our practice of what are the principles and practice of homeopathic system of medicine is there, which has to be included in that one. And the challenges which we are facing in our homeopathic research. The first challenge which is there is the funding and resource related. For a clinical research, especially for a randomized control trial, we need so much of money, which an individual cannot take it. We are not having enough pharmaceutical companies to fund it. So we find difficult because in Ayurveda and modern medicine, there are several pharmaceutical companies who are giving funds. And another thing, which is individualized treatment. When I went for the screening committee, the ICMR person, they told it's not possible for you to go with individualized treatment because we don't have a specific medicine for a specific condition, which is very difficult for us. And we don't have a global guidelines. We have to follow the guidelines which is there in the ICMR. So I went for this individualized this one, but they are not allowing us to go. Then we come up with the single medicine, but fortunately we got a very good result. And the topic is immunomodulatory effect of arsenicum album in patients, in children with V's, with the cytokine analysis. This is the research which I have done. And why pediatrics are important for us? You know, people believe homeopathic system of medicine as a safe medicine. So they will bring children for their treatment, and also it is very easy to administer. So we have to, all of you have to be very much practically oriented in all the examination of the lungs, liver, glands, all adventitious sounds, then only we could able to come up. And the challenges in pediatric case taking. Interpretation is very less. No? We cannot interpret because the mothers will come, they will tell the symptoms in exaggerated form. So we cannot rely on that one. Second one is the attitude of the physician is very important because we have to give maximum importance to the spontaneity of the expression of the mother. Along with that one, we have to see what all what all things are there. I have to stay here. Okay, I have to change the slide. That's the problem. Okay. Then this is knowledge of embryology. Yesterday, Dr. Praveen Jain has been telling about the embryological development. It is very important and the stages of development in the child, because if the normal developmental stages are not known clearly, the parents are in concern. So they will give unnecessary medications also. These are the challenges, and you will should have clear-cut observation skills. Our Guru, Dr. Praful Vijayakar told, we cannot, the mind, if your mind is not perceiving correctly, we cannot see it clearly. And whatever you are hearing with your eyes, with your ears, it will be lie. The mothers will tell lie, but you have to see the truth which is there through the eyes. So the observation skill should be very clear, like an eagle's eye. Coming back to the pediatric overview, everybody knows this one. Whenever the lungs and airways become easily inflamed with certain, whenever it's exposed to some allergens, it will be inflamed. As a result of which, there will be so much of clinical condition. I'm not taking too much of time in all these things. And it is a chronic inflammatory disease, always characterized by hyper-responsiveness of the airway. Infiltration of eosinophils will be there. Along with that, there will be obstruction of the airflow. It can be reversible. Remodeling of the airway and global cell hyperplasia, and as a result of which mucus hypersecretion will be there. Usually this wheezing will be triggered by upper respiratory tract infections like rhinovirus, respiratory syncytial virus. Along with, after that, it is associated with high degree of inflammation. Inflammation is the hallmark of or any disease condition. And it's for the students. What is the function of respiration? Why respiration is there in our body? What is the function of respiration? Sorry? Which organ develops first in embryology? At which weak heartbeat gets? Sorry? Tell loudly. 41st day. But fortunately, respiratory bud is the one which is coming first, which is on the 3rd week of pregnancy. In the embryological 3rd week, respiratory bud comes, and it becomes an organ by 10 weeks, and the respiratory system will fully mature at the end of the intrauterine life, isn't it? But below at the 3rd week, respiratory bud will be there. Below the respiratory bud, there will be cardiac node, but it grows faster than that of the respiratory bud. As a result of which, within 4-5 weeks itself, you will get the heartbeat. But respiratory growth will be there only at the end of the intrauterine life. Okay? This respiratory bud develops into, first, it changes into alveolar capillaries. Alveolar tissue forms after this one, followed by capillary, where venous circulation and mucus will be coming. And function of the venous circulation and this mucus is to filter whatever there is inside the body. So the air filling mechanism of the lungs is from below upwards, because the lung develops from below upwards. First, respiratory bud will be there. After the respiratory bud, there will be splanchnic mesoderm, which develops into alveolar tissue. Then the other tracheal, bronchi and other things will be coming. So whenever you are having any respiratory conditions, we will have this mucus secretion or crepitations, everything on the lower side only, even if it is pneumonia, TB, because of this condition. So whenever any particles enters, toxins enters the body is trying to defend it through various mechanisms. That one mechanism is cough. So cough is a defense mechanism which is vital for our body. So you are not supposed to give medicines immediately. Let the child cough, because while coughing, the child has to take a deep breath. Then only they can push out the toxin. So that along with the body, the lungs also will grow. Till what age lungs grow? Students, till what age lungs grow? Till the age of 14 years, the lungs grow. Okay? Whenever you breathe in, what is the volume of what all things are entering? Nitrogen, oxygen, and other gases. How much will be the nitrogen? Sorry? 78% of nitrogen, 21% of oxygen, and 1% of other gas. Nitrogen along with the oxygen, nitrous oxide is a piercing effect. It will go inside. Okay? And the other gases will be going out as carbon dioxide. In cases of asthma, whenever the mucus is there and it gets stagnated, it is called asthma. The pathophysiology of asthma, it is only for us, not for allopathic doctors, because bronchioles are condensed. There are two types of bronchioles, inspiratory bronchioles and expiratory bronchioles. Inspiratory bronchioles will be for the inspiration. Okay? So whenever condensation of the bronchioles is the basic reason for everything. Condensation. Bronchioles get congested. Okay? How it gets congested? Whenever it's GNM give you the answer for that one. Whenever a person is in fright, fear, anxiety, we will take more air, isn't it? So more nitrogen, more gases are taking in. As a result of which, nitrogen, oxygen which is there, that will be pushed to the heart. The nitrogen and other gases will be coming out. So whenever this nitrogen will be more, all over the mucous membrane, its mucous membrane is salty taste, isn't it? Sodium is there inside the mucous membrane. Sodium mingles with nitrogen, causing nitric oxide, which is corrosive, gelatinous, and thick. That will condense the bronchioles of the inspiratory tract, which causes inspirational asthma, which is unnoticed, which cannot be easily diagnosed. Okay? The patient will be walking, doing everything, but it is unnoticed. Whenever this patient, this is called functional asthma. It is the first stage of asthma, where we have to go with the plant remedies in cases of inspirational asthma. Like whenever a patient is having fear, anxiety, what will be the medicine first comes in your mind? Actonite, plant remedy. Then followed by, if it is a continuous fright, opium. Because it is the mechanism which is there. Neurocompression of the brain causes this bronchioles to get condensed. See how mathematically it is there. Depending upon the cause, the medicines change. Yesterday, Dr. Rajendran has been explaining all these things. All the plant remedies like opium, ignatia, anxiety with grief, ignatia can come. Isn't it? Lycopodium, pulsatilla, and even Nexomica also can come in this condition. So it enters. It is called acidic. What is the pH of mucus in the respiratory tract? Whether it is acid or alkaline? Acid. It has to be alkaline. Then only it can come out. The pH has to be, it comes to 7, above 7. So it has gone in, enters the capillaries, and it has to come out. While coming out, there will be little bit difficult because carbons are difficult to push. So the moment the patient is having difficulty, what will happen? The carbon pushing will be difficult, so that the patient will have heavy breathing, exertional dyspnea, which is little bit more dangerous than that of inspirational asthma. Got it? Inspiration asthma, and the patient will breathe through the mouth open. There will be foam in the mouth. Continuous irritation of the nasopharyngeal will lead to adenoid enlargement. And if this child is continuously taking some medications, then it will go to the sinuses also. How many sinuses are there? How many sinuses? What all? Okay. So whenever there will be difficulty in pushing another thing, the patient will be opening the mouth, breathing difficulty will be there. Then we have to consider medicines from mineral kingdom, like all kalis except kaliars, silesia, phosphorus, bromium. All these medicines will come whenever this also is not that much difficult for the patient to breathe. Whenever we check, then only we could able to find that the patient is having little bit aspirational asthma. And if it is both inspiration and aspirational asthma, there comes the difficulty. The patient will be difficulty in sleeping, lying down, because both the condition, the patient will be difficult. Whenever they lie down, that will compress the chest so that they won't get enough sleep. They cannot able to, so they will sit. All medicines coming is arsenicum album, first medicine. Kaliars, natronamase, arsidate, okay, Singam metallicum, and even plant remedies which is like minerals, Naxomica, conium, chamomilla, all these medicines will come. This is just for your information. So I took arsenicum album as my project because of all these conditions, because arsenicum album will work in all the conditions. Even if it is in the first stage we can give, but if you are giving unnecessarily, that will give you suppressions. Does homeopathic medicines have suppression? Homeopathic medicines will make suppression? Yes. Diagnosis of childhood. Whenever you have to diagnose a child with asthma, the child will have coughing, especially at night, which I told you. There will be whistling sound and breathing out will be difficult, and trouble breathing or fast breathing will be there. Current status, I am not going details of that one. In age group also I am not going. Different months. These are the 3 months which is very important for the people who is having increased asthmatic stages. Patient reported triggering factors in asthma. Dust, pollen, so much of things are right. Ice, drinks, everything is there. Then current treatment approaches. In allopathic system of medicine, these are the treatment options which is there in them. Limitations and challenges. We cannot give medications like that of in children like that of adults. That is one thing. In allopathy, don't ask. Severe episodes during my PhD also, some cases was having acute exacerbation, which has been taken care by the hospital college itself with other medications, so that I have deleted that patient from my this one. Then arsenicum and asthma. Everybody knows about this one. Arsenicum album is very effective for all the, and it has been a very main medicine for even in the COVID conditions. Because whenever the patient, COVID also, what happens? The patients were in a stage of fear. What will happen to me if I get it? So the lungs are weak. Whomever is having so much of fear, it is not because of the, now also COVID is there, but the patients are not in a stage of fear. The rationale behind my study is homeopathic medicines acts by stimulating the body's defense mechanism. No studies have done so far to link between the action of homeopathic medicines and the immune system by quantifying cytokines, which is very important. Homeopathic mode of treatment is the right choice to treat respiratory tract infection in children with wheeze. So far, homeopathy has been proved effective for the management of upper respiratory tract infections or recurrent respiratory tract infections in children with wheeze. However, it is important to show scientifically that our medicines act by improving the defense mechanism. This is the rationale behind my study. Everybody might be knowing about cytokines, which was the basic reason for all the problems when the COVID was there. I am not going into the details of all these things. Why I chosen this one, interleukin 1 and TNF alpha for my study. Immune system creates inflammation whenever the body is having some infection, injury, or disease. So, what is the inflammation? Inflammation is the hallmark and it is the defense mechanism of the body, which is very vital for our health. This inflammatory response is the coordinated activation of all the signaling pathways, including all the cytokines. Okay? And cytokines are predominantly released from the immune cells, like macrophages, lymphocytes, and monocytes. There are two types of cytokines. One is pro-inflammatory and second one is anti-inflammatory. Pro-inflammatory, as the name suggests, is promotes inflammation, and anti-inflammatory, it limits or inhibits inflammation. You just see the this in the black color, it is pro-inflammatory cytokines. Interleukin 1, interleukin 6, interleukin 11, 17, TNF alpha, and these are the pro-inflammatory. Along with this pro-inflammatory cytokines, if it is an acute inflammation, then interleukin 8, 16, and growth colony stimulating factor will be there. If it is a chronic one, then the other condition. So, all these cytokines are working in balancing way so that the body will be defended from inflammation. Okay? The role of TNF alpha and interleukin 1 in pulmonary pathophysiology. So, increased inflammatory cytokines and chemokines contribute to the infiltration of inflammatory cells and remodeling of the airways in the pulmonary epithelium. A study analyzed these molecules in bronchoalveolar lavage fluid. In 1917, one study was there which found that people who are having more pro-inflammatory cytokines like interleukin 1 and TNF alpha will have severe to moderate asthmatic attack, which is comparable to people who are having interleukin 6 and interleukin 17. Another thing is sequestration of polymorphonuclear leukocytes within the lungs is the basic reason for all acute and chronic pulmonary diseases. And this recruitment of these cells to the alveolar capillary wall occurs via the ability of another interleukin, that is called interleukin 8. I already told you that interleukin 8, it will, whenever the TNF alpha and interleukin 1 will be more in the bronchoalveolar fluid, they will have A49 epithelial cells, because gene expression of interleukin 8 from pulmonary type epithelial cells. Everybody knows pulmonary type epithelial cells is the basic one which causes acute respiratory distress syndrome. So whenever this interleukin 1 and TNF alpha will be there in their fluid, then they are prone to have acute respiratory distress syndrome. So I took these two parameters as my study. An aim and objective, that is to evaluate the effectiveness of arsenicum album in terms of reduction in cytokines like interleukin 1 and asthma, reduce the episodes of wheeze attacks, and reduction in the severity of the wheeze. And even the quality of life also has been examined. Material, it is a two-armed randomized control study. This is single-blinded control study. Age population was from 2 to 5 years, and study duration was 1 year. 102 patients has been recruited, 51 in both arms. One is placebo arm, and the other one is arsenicum album arm. That cases has been recruited from the Sharada Krishna Homeopathic Medical College OP, and we have taken some camps outside the college also. Altogether, 102 samples has been taken. And this sample, one thing is, my college was having a very NABH accredited lab, but the kit which I have purchased cannot able to run in that particular lab. It was a good thing for me, because so I approached Rajiv Gandhi Institute of everybody knows that institute now. It is a central government institute where I approached them and they are ready. All the there are several scientists we are ready to help us. So they took my samples and they processed there, and there also one Dr. Santosh Kumar was there who was helping me in my research. Fortunately, by the end of the study, this Sharada Krishna Homeopathic Medical College has been come up with an MOU with Rajiv Gandhi Institute, so that I don't want to pay extra for the lab which I have been used for the Rajiv Gandhi Institute. And this result gives authenticity, isn't it? More than the results which we are getting in the homeopathic medical colleges. And the tools which I have used is infant and toddler quality of life scale, was that everybody knows is a pain scale, but that also I have taken for my study. And this sample sizes, depending upon the severity, that changes. Sample size estimation was this. Inclusion criteria, exclusion criteria, everything was there. I am not going because the time is limited. And study finding will be the improvement in the terms of reduction in the frequency, duration, and severity of each episode in the intervention arm and comparable to the placebo arm. Then the interleukin and this one. That baseline characteristics of 102 patients. Baseline characteristics is a parameter measured in the participant at the beginning of the study. So that before any treatment has been given. So we can make sure that this can be these results can be comparable. These are the baseline characteristics. And distribution based on gender. Equality should be there. In my case, 46 males and 56 girls has been selected for my study. Then comes the distribution based on the age. I already told you 2 to 5 years. You see, maximum comes under 3 to 5 years. Then distribution based on family history. If the parents are having, of course, allergic condition is having a strong family history also. If both the parents are having allergic history, then the chances for getting allergic condition in the children is more. That you can see in this group also. Non-intervention, the blue line indicates the intervention group. Then past history. Children who are having repeated attack of cold, cough, rhinitis or bronchitis will be more prone to repeated attack of cold and this asthmatic attack. Birth weight. 2.5 is the normal birth weight, isn't it? Below 2.5, it is low birth weight. So, the infants who are under 2.5 kg are more prone because their respiratory tract has not yet been finally matured. Before that it comes. So, they are prone to asthmatic. In my case, 57 cases was below 2.5, below 3, 33, and above 3, 12 cases. ESR.
Dr. Santosh.
ESR is a non-specific indicator of inflammation in the body. Elevated ESR level can be an indication of an inflammation. But in case of pediatric asthma, it has not been a direct connection with the asthma itself. There might be some other inflammatory
Dr.
condition
Santosh,
also.
5 minutes more.
Okay, I'm finishing. In this group, ESR was found reduced in few cases in intervention group, and even in the non-intervention group also some cases has been reduced. So it has not been considered as an important factor in my study. And in AEC, eosinophils, it's a white blood cell count. AEC has been reduced in almost 86% of cases comparable to intervention group and non-intervention group. And VAS intensity, this visual analog score is used for the severity. It has been decreasing from pain 7, 8 to down during the treatment, but in non-intervention it's not that much decreasing. Then concentration of that's a basic one. Interleukins, it's a group of protein cytokines that play an important role in the immune mechanism. More than 27 cases has been reduced with our medication. And in non-intervention group, you can see only one case has reduced, the rest all has increased, which increases the authenticity of my study. Second one, concentration of alpha levels. That also in 12 cases, it has been increased with our medication. Some cases, even in the Rajiv Gandhi Institute, these people are telling every cases we won't get the result because there must be less sample, or the samples which has been processed for a long time also might have damaged this one. So the TNF alpha was clinically reduced in many cases. Then comparison of the mean values. Along with this TNF alpha and other things, complete blood picture and other thing has been checked, and it has been found that other parameters also has been reduced. That our treatment is effective in reducing other parameters also. You see that ITQL, quality of life score, the trend line shows that it is going up. That means the quality of life has been improved. In the non-intervention group, the trend line is not exponential, which shows that our medicines are effective in giving this one. Comparison of episodes before and after. You just see considerable reduction is there in the people who are having medicine intervention group, and there was not that much of reduction in the patients having that statistical interpretation. When the blood parameters including this interleukin 1 and TNF alpha has been analyzed, in the intervention group, the mean difference is very high. It has been clearly written. And the 95% confidence intervals when we checked, it also found beneficial, which is qualified by reference to the statistical significance to below p-value. It should be 0.005, which gives authenticity to my study. So, with conclusion, the study demonstrates the beneficial effect of arsenicum trioxide in reducing pro-inflammatory cytokines like TNF alpha and interleukin 1, indicating the effectiveness of homeopathic treatment in mitigating pediatric asthma. So even though we are going with a single medicine, we could able to get a very good result. That too with the lab from Central Government Institute. This is the study which I did. I am going for the exam soon. I hope this will help that. Thank you for your patient listening. Thank you very much.
Thank you. Thank you, Dr. Santosh.
Presentation is very good. The research aspect,
Thank you.
because most of the students are waiting for the, I think so, some evidence base.
Yes.
You have given the entire research aspect and these blood samples taken and improved. So no doubt arsenicum is a remedy for asthmatic attacks, even children to the adults. But my question is, have you taken the out of 102 sample size, how many X-rays you have taken before and after?
How many?
How many X-ray films of the chest of the pediatrics you have taken or not? Only blood samples you have taken are presenting here.
Yes. I have, because from Sharada Krishna Homeopathic Medical College, I won't get that much of patients. So the laboratory examination was difficult. Very few X-rays we have taken.
Sir, in this aspect, we have to show to the evidence to the other medical profession. The changes in the X-ray we have to see and we have to produce before the.
Yes, of course.
That is most important, sir.
That is there.
So what is the research is going on in the entire India, all research institutes, we have to show like that. Unless they cannot assimilate, digest our presentations. That is my request, sir.
Okay.
Humble request.
Yes, we have, I already explained, sir. I already explained that we have taken most of the cases from medical camps where this facility was not there. We are taking the lab people along with us. So blood sample was the only one which we have taken. That is the difficult. And even while doing this research, so much of difficulty was there, sir. The sample size, to get that 102 sample size, it was difficult. The moment the people
Yes,
are
sir.
taking.
At least 30 is accepted.
Yeah, but for
30 is
my
accepted internationally. So we have to show at least X-rays before and after treatment.
Yes, sample size estimation is there. It is not possible for us to take that one.
Yeah.
That estimation rule is there, that has to be followed
Yeah.
for all the research. So while doing that statistical analysis, we have to go with 51 cases. So
Okay,
102 cases has to be there. So that cases has been taken from most of the camps.
So it
itself.
is randomized or non-randomized, sir, you have done?
Randomized.
Randomized.
Yes,
So
single blinded study.
Okay, sir.
Okay.
Thank you.
Any other questions?
Thank you. Thank you, sir. Thank you so much.
Yes, we have taken care of that. The college has taken care of.
Thank you. Thank you, Dr. Santosh. Please.